go ahead and get started. We have lots and lots of questions, so bear with me as I scroll through these. So first question, how does this compare to something like Morpheus 8 or Genius, which is a microneedling radiofrequency device? So Ellacor is a first in its class device. It is the only skin tightening device that does not use heat. So with all the other skin tightening devices that we use, basically what we're doing is we're putting a controlled heat injury into the skin, and this heat is causing a biological response in the body that gets the body to build new collagen. So Ellacor, what it's doing is we're not relying on heat to have its biological effect, because in some people, heat, it can be unpredictable. And in this case, what's happening is the actual cores of skin are being removed. So this is more better thought of as like a surgical procedure, or a very minor surgical procedure, as opposed to a laser. And when we're removing the skin, we're removing small columns, and each column is less than 0.5 millimeter. So the column itself doesn't scar. But when you take all these columns and add it together, it accounts for about 5 to 7% of the skin in that area. And if we're removing 5 to 7% of the skin in that area, as you can imagine, there's a fair amount of tightening that could happen even after one treatment. And if you do this several times over the course of 6 to 12 months, you can get a pretty decent amount of tightening along the jawline, softening of some of the folds. And what we've been most surprised with actually is improvement in the fine lines, particularly in the cheek area as well as the upper lip. So it's different than something like a Morpheus 8. I think it's a little bit more predictable, particularly for fine lines. All right, and then someone asked, can you lose fat volume? So the answer is no. Basically, what happens with these devices is the needles are going in through the skin, and the minute they hit the fat, they stop. So typically, because the needles really slow down once it hits the fat layer, we're really just removing the epidermis, which is the very tippy top layer of the skin, as well as the dermis where the collagen lives. So we haven't really seen much in the way of fat removal or any volume loss in our patients. Okay, let's see. Bear with me. Someone asked, can it be used on the body, such as the arms? That's a great question. Basically, right now, it's technically only approved for use on the lower face and jawline and just above the upper neck. There are people who are using it regularly on the body. I don't think the technology is quite yet optimized to be used on the body. The really critical part of this procedure is that the cores themselves have to come out. So if the needle goes in and a core is not removed, you're basically doing a fancy microneedling device without any energy. So very minimal clinical benefit is seen. And areas of the skin, like the even parts of the neck, as well as the upper arms, abdomen, or thighs, we just haven't seen consistent core removal. So while it's safe, we've seen really inconsistent clinical results from treating the off-face area. And I think the device has to be further optimized to be able to do this effectively. So someone asked, does the 0.5 millimeter that is removed not just grow back and replenish itself? It does grow back, right? But you have to think about the fact that when there's wound healing, we get contraction. And if you think about what a plastic surgeon does during a facelift, one of the things they do is they remove the excess skin in front of the ear, and they're removing that in one big chunk. And of course, they're leaving a scar in front of your ear when they do that. So instead of removing the big piece of skin right here, we're removing the equivalent in terms of surface area, but we're doing it in just the small little incisions that you cannot see after a few weeks or so. So you do get that contraction. The skin does grow back, and that's part of the reason why we can do this and it heals so efficiently. But you do get new collagen synthesis and contraction, and you do see tightening. Someone asked, lack skin on the body. We already discussed this. It's not quite there yet for body tightening, but it will be there in the future. I'm confident that they're working on the technology and optimizing it. How long to see results? Well, with anything that does skin tightening and fine lines, it does take a few months to build collagen. So it will be something that you basically will do and will recover from in the course of a week or two, and then pretty much look normal. And then over the course of 2 months after the treatment, you will see the results. When they did the clinical studies, the patients were treated with anywhere between 2 to 3 treatments on average, and the treatments themselves were done about once a month apart. In our office, we've taken a little bit more of a conservative approach. We found that if you actually wait 2 months after one treatment, you can see the results of even the first treatment and kind of optimize and target the particular areas more either efficiently or aggressively on the second treatment. So we've been spacing it out that way in our office. We recommend at least 2 to 3 months in between treatments in order to kind of optimize the results and get the best possible clinical result for our patients. So someone asked, for lax jowls, what is the difference between this and Sculptra? So this is I want to put it in 2 very different categories. So Sculptra is a filler. It's in a category of fillers that's called a biostimulatory filler. So the way that product works is basically it's being injected predominantly in the fat and onto the bone, and it's starting a biological process that helps your body build collagen. So when the way that helps the jowls and indirectly in people is it helps build volume in the upper part of the face to help support the skin. Something like Ellacor is actually a really nice complement to Sculptra. The reason is because this is also building collagen, but where it's building collagen is in a different plane of the skin. So while Sculptra is helping kind of reinflate the balloon as well as provide structural support for our skin, what something like the Ellacor is doing is it's tightening the shell of the balloon. So the 2 of them together for a particular patient can be a nice 1-2 punch. Someone asked, can you do some Ellacor in people who have filler, and does it interfere? And in fillers such as like Sculptra that actually help build your own collagen, you can do Ellacor while someone has Sculptra in their face about a month or more after injections and really not affect their filler. If someone has more of the gel-based fillers like Juvederm or Restylane, you have to be a little bit more careful with those fillers when we do Ellacor, because of course those fillers, if they're placed in a superficial part of the skin, the needling device can actually remove it. So for individuals who have gel-based filler, we have to be a little bit more careful and discuss the treatment plan ahead of time in order to make sure we don't inadvertently remove the filler. But with Sculptra, 1 month afterwards, something like the Ellacor is totally fine, and they're very likely to actually augment each other and give even better clinical result. All right, someone asked, can you please repeat the info on downtime? Okay, so the downtime we found in patients is variable, and it depends quite frankly on your definition of downtime. So I'm just gonna go through again, basically what's involved in the healing process and what most of our patients experience after an Ellacor. So because you do have open holes, basically very small microscopic holes in your face for the first 2 or 3 days, you have to be really careful about what you apply to your skin, and we don't really want stuff getting stuck in the skin such as makeup or sunscreen. So basically the first 2 to 3 days until those holes are closed, most patients are advised to stay basically at home or minimal contact with the outside world, only because you really can't cover up with anything. You can't wear makeup, you can't wear sunscreen. So you basically keep your skin clean with a gentle cleanser, and we provide you in the office with an ointment to use 2 to 3 times a day for a very thin layer of moisturizer. After about 72 hours, we do bring most of our patients back. There is some patients who have bruising at that point, and we go ahead and zap your bruising with a laser such as the V-beam to help kind of slow down your or speed up your recovery time and make that bruise go away faster. At that point, most patients' skin is closed, and you can cover up with things like tinted sunscreen or makeup and not have to worry about it getting stuck in the skin. So most of our patients feel about 3 to 5 days they're cover-upable with makeup and presentable to the world. Now, some patients get red marks that can last past a week or 2, and that's sometimes difficult to predict. We have found that if we bring those patients in and do something like a V-beam on them within a week or 2 of their Ellacor, the redness does resolve faster, but that's kind of the tricky part of the downtime. So while your immediate downtime from the holes closing itself is usually done within 3 days, and you're pretty presentable with makeup by about the 5th day, your skin may not be, back to prime time without makeup for a couple of weeks. Someone asked, will we be able to see other attendees' questions? The answer is no, but I'll be reading them out loud. I'll answer them all. So it says 2 to 3 treatments, then would a 45 to 50-year-old need to repeat treatments yearly? So that's a great question. This is a new in-class device, so we don't really know the answer to the specific answer, at least from an evidence-based standpoint to that question. But as we all know, especially those of us who do this procedure or who have done any of these aesthetic procedures, or even patients who you guys have done this over the years, you know that we don't stop aging, we don't age in a vacuum, and of course you're going to need more treatments down the road, whether it be a series of Ellacors, or if you can just maintain with one, or if we'll alternate with another skin tightening device. Time will tell, and we're going to figure that out together as the technology evolves. Okay, I'm wondering about scarring post Ellacor. So we've done quite a few Ellacors in the office. We've had it in our office since about November. And those of you who know me know I'm a pretty straight shooter, and I answer things. I have no poker face. So if I'm lying, you'll know the minute I'm telling you. But I haven't seen any scarring from Ellacor. What I have seen in a handful of patients is that they do have redness that can persist. And I did have one patient who had redness for a couple of months, but it resolved without any sort of intervention. And you can't tell at all now that she had any redness or any long-term redness from her Ellacor. So that's probably the worst thing I've seen from it. Of course, if you're putting too many holes in, or you're overlapping your holes, or there's an issue with technique, there is a risk of scarring, but we obviously are very careful and try to avoid that. And then with any of these technologies, it is possible. And if there's some past problem with wound healing, it can be a predictor for a potential problem with Ellacor, and we can go through things like that in an individual consults if you decide to book one. But in general, for the average patient, I have not seen any problem with scarring. And in fact, they designed the device with these holes small enough because they know that a hole of this size or smaller heals without scarring. Okay, someone asked about pain. So pain management is pretty straightforward for Ellacor. The only part that hurts with Ellacor is injecting the skin with the anesthesia. They didn't show that in the video, but that's probably the only part that is uncomfortable. We do have a couple of options for patients in the office. We bring you into the office. We, of course, apply numbing cream. And then in addition to the numbing cream, you do have the option of laughing gas, which is nitrous oxide during your injections. The injections themselves are basically the same stuff the dentist uses, but it's injected locally into the skin. So any of you who had filler and remember that kind of sting right before the filler is injected, it kind of feels like that. Or if any of you had skin biopsies, it kind of feels like that kind of stinging sensation. The injections with the anesthesia take about 5 minutes or less, and we take our time. And once you're numb with the anesthesia, it's literally pain-free. So you won't feel anything after the anesthetic is injected. So it's about 5 minutes of discomfort, and the rest of the procedure is really straightforward. Pain management afterwards really is virtually none. You will feel a little tender. Obviously, you had a small procedure done. You also will feel a little bit you'll have some swelling afterwards as well. But it's nothing that a patient has required pain meds for afterwards, and certainly not anything I've gotten a phone call for pain post the procedure. Would this work for neck crepiness as well? I do think in the center part of the neck, where you can stretch the tissue over the bone, you can actually get cores there. So I do think it will help with this area. We've just started treating necks a few months ago, and so we'll have more information, down the road. Bruising. The bruising, someone asks, is there much bruising? The answer is that's variable. So if you do decide to come in for a consult, we'll provide you with a list of kind of pre and post care instructions. And one of the biggest things instruction is what blood thinners to avoid. So what we'll do is, we advise that you kind of avoid the blood thinners that's possible for you. And that will really minimize your bruising. In addition to, we do offer, options after the fact to help clear up your bruising faster. And I haven't had any patients who've had any significant bruising that lingered past 5 to 7 days. So we'll get you turned around in about that 1 week downtime. Great question. Someone asks, for men, are many facial hair beard follicles damaged? So that is a really good question. And of course, if you think about what this technology does fundamentally, it is taking needles that are being inserted into the skin and it's removing skin. And if you inadvertently, just by chance, remove hair follicles, you are going to end up losing hair in that area. So the clinical studies, there were no men done in the studies. So there's no real long-term evidence in terms of treating men with hair and seeing what happens to their beard. In our office, we've been very conservative because, of course, we don't want to affect anyone's beard line long term. So if you're a man and you want to do this procedure, there is a small chance that you could have permanent hair reduction or patchiness in the beard after this treatment. So if you're someone who really likes wearing a beard, this is probably not the treatment for you. And as you can tell, that's me. So I'll be getting one of these done anytime soon. But if you're okay with losing some facial hair or you shave closely regularly, then you can do it very safely on a man. Can you continue to do Ellacor more than 3 times as a maintenance skincare option? Yes, even though in the clinical studies there were on average 2 to 3 treatments done per patient. Since the machine has come out, there's been patients who've had 4 treatments without any sort of problem. So in theory, yes, you can absolutely continue Ellacor, but of course there's a limit to all these technologies. So perhaps the best strategy is something like you're suggesting, doing a series of 2 or 3 and then maintaining down the road. Someone asked, is this safe for people with EDS? So that's a great question. EDS, for those of you who don't know, is called Ehlers-Danlos syndrome. It's a connective tissue disorder with impaired wound healing. And this goes back to the question about scarring. And this is, you want to be careful in the patient with EDS, perhaps perform a test spot. Depends on the type of EDS they have and what their current scars look like. So this would be someone in a patient you would be concerned with scarring about. So you'd have to have that discussion more clearly. But yes, in theory, it can be safe depending on the type of EDS they have, but we proceed with caution, probably do some test areas, do a lower density and see how you heal. Pain, we talked about. Someone asked, is it easier than Ultherapy? The answer is definitely easier than Ultherapy, okay? Are there any adverse effects such as infection? So I have actually not seen an infection with Ellacor. It turns out in general, just as a general rule in dermatology, that open wounds do not get infected. So because these holes are left open, I have not seen a single problem with any of this with patients. In terms of things that have been reported in the community, if you come in with stuff on your face like makeup or sunscreen and we don't get it all off, there is some people who've had some impaired wound healing from that, but it hasn't had any long-term problems. And in fact, in our office, we basically ask everybody to come in with nothing on their face so that there's no risk of that. Other side effects, other infections you do worry about in certain patients who have a history of fever blisters or cold sores on their lip, that you can have a reactivation. So if that's the case for you, we do put you on an antiviral medication to prevent this. But other than, the temporary inconvenience of looking funny and having a little bit of swelling and some bruising and some patchy redness, most people have turned around in about a week's time. And I have had a handful of people who've had redness persisting longer than a week, but we've been able to manage that, and it's certainly cover-upable. So as long as it's something you're prepared for, you can definitely have the treatment without an issue. Okay, someone asked for skin tightening around the jawline. How does this compare to Profound, Thermage, etc.? So this is a great question. Profound and Thermage and Ultherapy differ in a lot of ways. So what Thermage and Ultherapy are doing is they're getting the top and deeper layer of this muscular skin, and Profound is just getting that top layer. I will say that Ultherapy and Thermage are probably better for a patient who wants lifting, and something like an Ellacor is better for someone who wants some of the laxity as well as the excess skin and some of the fine lines removed. And the reality is, in an ideal world, it's good to do procedures in both these categories because they're complementary, right? So one is addressing the actual skin and the redundancy in the skin, and the other one is addressing the strength of the collagen layer in the muscle tissue area. Someone asked, is 42 years too young, 42 years old too young? It really depends on the person and what kind of 42-year-old you are. I've actually found, surprisingly, that the younger patients take a little bit longer to heal, and they have a little bit more downtime. The more mature patients actually heal much faster. And quite frankly, I think they get better results. So if you're 42 and you want to do a skin tightening device, you might be better served doing something that's a little bit more straightforward and less invasive, and you'll probably get just as good, if not a better result. Can it be used on the forehead? No, it's not currently approved for the forehead. I have heard of some people who have treated foreheads and with subpar results. So the technology is really not designed to be used there at this time, but it is probably something that that will be optimized in the future and may potentially be done on the forehead. But for right now, no. So I'm just looking at the questions. Okay, we're trekking along here. You guys are asking great questions. I really love the engagement here. Eyelids, does it work on eyelids? The answer is no. The needle array is really designed for thicker skin. So for right now, there is no, we are not treating either upper or lower lids with this technology. Someone asked, is this okay to use in tandem with Botox? And the answer is yes, that's a great combination. When we Botox the neck, one of the things we're doing is we are taking that muscle and we're relaxing the muscle so it doesn't pull down on the jawline. My neck is no longer Botox. I can show you what that looks like. I'm scared to see it on Zoom, but you can see what that does to my jawline. It really pulls it down. So if you Botox that area to release that muscle and then do something like an Ellacor, you're really hedging your cards in your favor, because then the skin really doesn't have any downward force and can really pull up and tighten. How large of an area is done at one time? Great question. So typically we start with just underneath the bony prominence of the cheekbone. So just about me right here on the sideburn. And we treat right in front of the ear all the way to the fold here on the nose. Same on the other side, obviously upper lip, chin area. And then we do treat down onto here. And then in select patients who feel like they have crepiness, we do treat down onto the neck. So it really depends on what your particular needs are. But for most people, what we're doing is here, here, all the way down to just underneath the jawline right here. And so that answers the question, what part of the face and neck is covered? How long do you avoid blood thinners? $1 million question. Obviously, I would say as long as possible. However, it depends on the blood thinner. Some things like aspirin are actually, and Advil actually have a really long effect on the platelets. So for something like that, 2 weeks is ideal. For other products, such as like green juice, salmon, fish oils, a week is probably fine. So 1 to 2 weeks is probably the best answer to that question. Oh, someone asked, can you use Ellacor to reduce scars and or tattoos when it hasn't been able to get rid of fully with other lasers? Great question. That is something that people are actively working on. There's a limited amount of data. Of course, there's no studies that have been done. We have seen some good results on some post-surgical scars on the face, as well as surgical scars on the scalp from hair transplants. And of course, with tattoos, because you're mechanically removing the skin, you do have the ability to help clear up a tattoo. And so there's some reports of that as well. So it's something certainly if we have to get creative, we can use for this. It's not first line, but it probably is something that will be useful for stubborn scars and tattoos in the future. Someone asked, are there any meds that should be avoided before the procedure? And I would say mostly the biggest thing to avoid are blood thinners, and don't just think of medications, think of supplements as well. What is the best way to prep for the procedure other than avoiding blood thinners? Great question. There's really no reason you have to stop your skincare leading up to it. So you can certainly use your retinols, your vitamin C's leading up to the procedure. If you are someone who's at risk for pigmentation, we will talk about potentially using a bleaching cream ahead of time to minimize the potential risk of pigmentation from the treatment. And that'll be individualized per person. If you want to be someone who wants to hedge your bet in the right direction and increase your, try to increase your results, your clinical result, as well as decrease your downtime, there is a great product that some of you may be familiar with called Elastin Nectar that has been shown that if you use it for a week or two prior to your procedure, it actually speeds up your recovery time, but also helps make your results better, because what it's basically doing is helping break down the damaged collagen to let the new stuff move in. So that is something you could potentially use to prep your skin for the procedure. Is it safe for melasma or hyperpigmentation prone skin? And yes, it is. So of course, anyone with a history of hyperpigmentation or melasma is in theoretically increased risk for pigmentation, but because it's not a heat-based technology, it's far less likely to do it than, let's say, a fractional laser would. But it's something we discuss in your consultations of potential risk, and potentially think about pre-treating you with the bleaching cream prior to treatment. The other thing that I'm pretty strict about, if you are doing a treatment of this nature and you are at risk for hyperpigmentation, or you're someone with melasma, or you're someone who likes to get a lot of sun, this is not a summer treatment for you. So even though it's not a laser and there's no heat, we would recommend you do the procedure in the winter months. And I know, we don't really have winters here, although we did last year, but typically the winters here, while they're still sunny and warm, there's just less daylight hours. So between daylight savings time, usually October to March would be the ideal time for someone with pigmentary issues to do a procedure like this. Someone asks, is it $3,500 for one treatment or for the series of 2 to 3? It's $3,500 for one treatment. How many times have I performed the procedure? Great question. That's always, fair and transparent honesty. I would say more than I can count. I would say I'm probably close to 100 now. Someone asked again, how does it compare to Ultherapy? And again, just to reiterate, Ultherapy is something that's done for lifting the tighter tissue layers, and Ellacor is going to be better for tightening the actual skin and helping with the laxity that you can kind of pinch, as well as some of the fine lines. I think they're really nice complements to each other. In an ideal world, I'd like for people to do something in both categories, not necessarily at the same time, not even in the same year, but just as a long plan moving forward. Okay to use if you have fillers? The answer is yes, but just to reiterate, some of the gel fillers, we'll have to talk about how long they've been placed there. And in particular areas, particularly around the mouth, we have to discuss potentially removing those fillers. I'm just reading some of these questions. Someone asked, this is a great question. Can you lift the upper lid by virtue of tightening? And we have seen this clinically, that of course, one of the things that happens to us as we get older is that our lower lip starts to lengthen. And there is a surgical procedure called a lip lift, where they actually incise this area, remove the excess skin, and pull the lip up. And we found that, with Ellacor, because we're removing skin in this area, that we've been able to shorten the distance in patients with this, and even increase the amount of lip show they have, as well as improve some of the fine lines. So this is actually an area where I think Ellacor shines really well and has a nice result for patients. And the company I know is working on a study to kind of quantify the amount of lip lift you can do. So yes, this is something that you can do in this area, and it does tend to work pretty well here, and people have been happy about that. What kind of anesthetic technique is used? Great question. Just to reiterate, we put topical numbing cream. It's topical lidocaine that's applied for 30 minutes. Then we go ahead and inject you with lidocaine with epinephrine. This is exactly what the dentist uses. And if any of you have had skin biopsies done, this is the same product that's used, and that's directly injected into the skin. Like I said before, that's really the only uncomfortable part. Takes 5 minutes or less. And if you need extra support like laughing gas or even a medication to relax you, such as a Xanax, we're happy to provide that for you. We can talk about that more at your consultation. Then after that, it's pretty much pain-free. Someone asked, isn't the healing that causes contractions scar tissue not the same kind of collagen, right? This is a very good question. So the answer to that question is no, it's not scar tissue. And there is something about the size of the hole that dictates the way it heals. So when they did the studies with Ellacor, they basically took skin initially when they were trying to figure out what holes to remove. They took skin and they did different size needles on them. They found that this 0.5 millimeter or less, the hole itself, once it heals and you look at the samples of skin under the microscope, you can't find the scar you can't find what looks like a scar underneath the microscope. So it doesn't look the same way underneath the microscope that, let's say, a surgical scar looks. The collagen is different. So there probably is something about the size that's really important, not just because it doesn't leave a physical scar, but also because it doesn't heal in the way a scar would underneath the microscope. Pain, like I said, I would say most patients will tell you their pain during the actual procedure is pretty much a 0, maybe a 1. It's everyone's really comfortable. Pain during the anesthesia is variable, but I would say it's like a 3 or 4 for the average patient on a scale of 0 to 10, 0 being no pain, 10 being the worst pain possible. And basically, it's pretty straightforward. And the anesthesia, like I mentioned before, really lasts 5 minutes or less. It's pretty straightforward. Scabbing or bleeding problems possible. I have had a handful of patients who felt like they had a little bit of oozing for about a couple of hours after the procedure, but certainly not like bleeding to the point where you'd actually be worried about any sort of significant blood loss or even more than just a minor inconvenience. The lesions shouldn't scab because, of course, we're applying ointment to them, but there you will have like a pinpoint red mark there that you'll see in about 2 to 3 days, and that's just the hole being closed. All right, I think we're coming to the end of our questions. Someone asked, how long does it take for the whole procedure once you're anesthetized? Usually 30 to 45 minutes. And like I mentioned before, the procedure, you're very, very comfortable during it. If someone wanted to start only with the upper lip, that's for smaller areas. And I would recommend you come in for a consultation to discuss that. But we do certainly have patients who really just want to start with upper lip or feel like that's the only problem that bothers them. And like I mentioned before, that is an area that works really well on people. And that's something we can certainly talk about. Someone asked, will Ellacor reduce double chin? And that's a hard question to answer without seeing someone's particular double chin. It depends on what the cause of the double chin is. If it's skin laxity, you do get improvements in the contour of this area, not just by removing skin here, but also tightening the skin up here and having everything pull up. So we have seen that. If the laxity here or the fullness in the double chin is because of a lack of bony prominence or the fact that you have fat there, that's better treated with something like injectables, like a filler, or if you have fat, something like Kybella or cool sculpting, and that'll be something that can be individualized and tailored to your particular needs. Someone asked, what do you do if the results are uneven? I frankly haven't seen uneven results with this treatment. We take a lot of care in removing making sure we remove the same number of cores on each side. Of course, if you treat one side at 7% and treat the other side at 3%, you can, in theory, get a different uneven result. But I have, of course, we take care and make sure we're putting more or less the same number of holes on one side than the other. And I haven't seen any sort of unevenness with this treatment. Is this safe for all skin colors? So great question. The clinical studies were done in what they call skin types 1 to 4 individuals. They give people a rating or a scale of 1 to 6 in skin type. And the 1 to 4 people, skin types 1 is like a very fair skinned, always sunburns. And skin type 4 are people who are more olive or Mediterranean skin or Asian who almost rarely sunburn. So they did do those studies in those patients, and they had very low incidence of side effects such as pigmentation. Everything resolved without any sort of intervention. We have treated people. In fact, the patient I think they showed in the video was a slightly darker skin type, and it is theoretically safe in all skin types. Of course, in darker skin types, you do have a greater risk, a theoretical risk of pigmentation. But there's lots of reports in the community of people treating patients with Ellacor who've treated all skin types without any significant problems. But we would have to talk about your particular needs, as well as trying to hedge the bets in your favor, such as not doing the treatment during the summer, or perhaps treating with the bleaching cream in order to minimize that. Someone asked, what if you've been diagnosed with rosacea? Haven't had a problem with rosacea patients with Ellacor, and I don't see that as a particular contraindication. All right, I think we are done. Hold on, there's a couple last minute questions that came in. So what about going over any facial moles? We typically try to avoid treating the mole itself, particularly if it's a larger mole, just because we don't want to do anything that'll alter the appearance of that mole and prevent us to be able to monitor the mole medically. But we can easily work around moles without any sort of problem. Who is allowed to perform this procedure? An esthetician, derm, or a registered nurse? $1 million question, depends on what state you're in. Every state has different laws. In the state of California, any MD, which is a medical doctor, or DO, which is a doctor of osteopathy, nurse practitioner, PA, or registered nurse can perform this particular procedure. In our office, it's myself, I'm a dermatologist, and Dr. Helen Fincher is also a board certified dermatologist who performs the Ellacor procedure in our office. Okay, and then one last question. Someone asked a good question. Actually, there's two questions. How long does it take for the whole procedure once you're anesthetized? And I would say door to door with the numbing cream, and getting yourself numb, and then of course we clean you sterilely, and then getting you numb with the cream, cleaning you sterilely, and then injecting you with the anesthesia, and then treating the procedure. Expect to be in the office for about an hour and a half or so. You can drive yourself back and forth, especially if you don't take medications. All you do is numbing cream and or laughing gas. You can drive yourself, so there's no reason why you can't drive yourself home safely, unless we give you something like a Xanax to relax you. Okay, if someone asked, do surgeons hate this? And the answer is no. A lot of surgeons actually have this device, and we're all looking to augment what we do for patients. And not everyone's a surgical candidate. Not everyone wants surgery, and not everyone is ready for surgery, right? So this is a great option for patients who didn't feel like they had an option before and didn't want to do something surgically. So I would say that in general, all of us dermatologists, plastic surgeons are all really excited about this technology, and the more people we can kind of help empower, the better. How many sessions of Ellacor equate to one facelift surgery? It's like comparing apples and oranges. Remember, one of the things they do during a facelift is they don't just remove excess skin, but they tighten the muscle layer. So it's hard to equate something like comparing the surgery to something like an Ellacor, because it's not quite doing the same thing. So, that's a good discussion to have with somebody during a consultation. You really want to weigh all your options, and not just the stuff we offer in the office, but even things like surgery that we don't do in our practice. Because if it is something you're ready for and a good candidate for us from a surgical standpoint, it might be more cost-effective long-term to do something more definitive like that. That's something I'd be happy to give my honest opinion on during a consultation, if you are somebody who's open to that. But oftentimes people who come see us in our office are people who've kind of already ruled out something like a surgical option. So this is a good alternative for somebody who's not quite there yet.